Mr.BB.
It's Live in the D with Mr.BB every Thursday at 9 a.m. right here on WVI 107.3 Radio We Can See. All right. Again, we are back, and we have our guest with us, Dr. Wanda Shurney of the Sickle Cell Disease Association of America, and she is here to tell us a little bit about herself and the association. Good morning, Dr. Shurney.
Good morning. How are you, Jabril?
I'm good. How are you doing?
I'm doing great. Happy to be here.
Thank you. Thank you. Happy to have you. So can you start telling us, or first, how are you today?
My day is going fine. I have to go to the dentist after this, and that's not my favorite thing to do.
But I don't think it's anyone's.
Yeah, we'll get over it.
Okay, but can you tell us about the Sickle Cell Association and how you came even to be at the Sickle Cell Association?
Okay. As you know, I'm a pediatrician by training, right? And I've had the privilege of spending the last 30 years of my life taking care of children living with sickle cell disease at the Comprehensive Sickle Cell Clinic at Children's Hospital. My father, Dr. Charles Whitten, founded the National Association for Sickle Cell Disease, which is now the National SCDAA, Sickle Cell Disease Association of America. And he also started the clinic at Children's Hospital, the Comprehensive Sickle Cell Clinic, and he also started what started off as the Sickle Cell Detection and Information Center, but now is the SCDAA Michigan chapter. And when he passed away 8 years ago, I moved to the SCDAA Michigan chapter to provide some leadership there. And I really recognized that I could have a bigger impact of the lives of individuals living with sickle cell disease at that organization than at the Children's Hospital Clinic, because they hired another pediatrician who was doing a great job there.
Okay. So that's how you got started with the association, through your father, and then you just kept on as a pediatrician. Now, what do you have any experience, because you were my pediatrician at one point, and then I know with the transition because of Children's Hospital, where I had to go on and go to an adult hospital.
Right.
But what is your, or if any experience do you have with adults with sickle cell, or do you even work with adults with sickle cell at all?
Well, now working at the SCDAA, I have a lot of interaction with adult patients, and the nice thing about it, Jabril, is that a lot of these patients that I interact with are patients that I took care of, just like you when you were a kid, you know, and now you're grown. But one of the reasons that's so important is because one of the major focuses of the SCDAA right now is improving the lives of adults living with sickle cell disease. I always say it's almost a blessing to be a pediatrician taking care of patients, because children with sickle cell disease tend to be sick and then get better and then be sick and then get better. But sometimes with adults, because of the wear and tear on their bodies from these sickle cells that have been blocking their blood vessels all their lives, sometimes they become chronically ill. And they can be very difficult to take care of because they have problems in every system in the body. They may have heart issues, they may have lung issues, they may have kidney issues. And so, and then the other big problem is that there are not a lot of doctors that are interested in, willing to, or capable of taking care of adults. And so that's one of the things that we're doing. We have a HRSA grant, a Health Services Resource Administration grant, to help educate adult physicians in the care of adult patients with sickle cell disease, so that people with sickle cell disease are living longer and longer. But one of the things that we want to do is we want to help to improve the quality of the life that they're living.
Absolutely, absolutely. I see on what you said there, again, the sickle cells can come and affect the heart and the liver and the lungs. I myself have had liver damage from, and my doctors argue, my GI doctor and my now my sickle cell hematologist doctor argue that, well, it's nothing from sickle cell, this came from something else. But because of the fact that I have sickle cell, they did have to look at it. So I do know the effects that can have on you with the yellowing of the eyes, exactly, with the jaundice.
Yes. And you mentioned, Jabril, you mentioned leaving Children's Hospital and going to the adult side. And one of the things that I want to point out is during that transition period, that's when we lose a lot of patients, because sometimes they don't get good follow-up care, and sometimes they get most of their care in the emergency room, which we know is not the best place to get regular care. And then sometimes our adult patients get, when they go in with severe pain, they get accused of being drug-seeking or drug addicts, you know?
Absolutely.
And so that's a real problem. They have to wait hours sometimes in the emergency room to get their first dose of pain medication. So what we're really trying to do is advocate for our adult patients and to help improve the care that they get. We have a really great doctor, Dr. Paul Swerdlow, at the adult clinic, but we want to help. We want to get him some help. And there's Arthur Jett, and there's Lisa Litzy, and they're really doing a good job. But we have about 600 patients there, and so we really want to be able to provide resources for our patients.
That is wonderful, and actually the names you were naming, I've seen Dr. Jett,
Right.
especially for some time now. I've seen Dr. Swirlo. I started out with him.
Right.
Dr. Lucy, I think you said. I think I saw her once or twice.
Okay.
So yeah, they are fantastic doctors
Right.
and they have me the way my treatment has gone. They have me on transfusions every 3 weeks, but basically with that, I was able to reduce my medicine. I was
Right.
able to really and now my life with my lifestyle and
Right.
doing the radio show, I'm really able to feel like I was able to do more
Good.
than I was when I was a child because of going back and forth in the hospital. So for me, the transition has been pretty well. It didn't start. It started off a little rocky because, like you said, when we go into the emergency room, they was being drug addicts, and then we're in pain. I remember one day I was sitting there in a wheelchair, was basically ready to pass out. My father got really avid and mad because he's like, take care of him, and then he has to wait.
Right.
We have priority, and
Yeah, it
so
can be very frustrating. Yeah.
it has been in some ways, but I appreciate all the doctors who have taken their time to really look at this thing, you yourself included, and see that we are not faking it. We are paying, like the t-shirts we've made for the walks.
Our pain is real. Yes.
So can you tell us a little bit more about the before we get into the walk, what the mission of the Sickle Cell Association, especially the Michigan chapter, is?
All right. So really, our first mission, I always talk about, we have a trifold mission, and the first has to do with maximizing the lives of individuals living with sickle cell disease. Now, there are certain things that we can't fix. We can't fix the fact that you might have pain from time to time, but there are things that we can do to help improve the quality of your life. And I would like to just brag about one particular program that you know a lot about, and that's Project Enrich.
Yes.
Because sometimes children with sickle cell disease, they miss school, you know. Sure. Sometimes they have yellow coloring in their eyes called yellow jaundice, and they grow more slowly, and they get teased at school, and then they fall behind, and then sometimes they get really frustrated. And believe it or not, sometimes they even fake pain to get out of going to school because they're so far behind and whatever. So we have developed a program called Project Enrich, where we have adults living with sickle cell disease tutoring students. And we go and we pick them up in vans and we bring them to the SCDAA right there on the Lodge Freeway, and we feed them a healthy meal, and then they get help with their homework, and we have them do special presentations to get them used to standing in front of an audience, and then we teach them Tai Chi and yoga. And one time we had a music therapy program, and one time we did art therapy. We had a special movie. We showed the Queen of Katwe, so because a lot of our patients like to play chess. And you're a tutor in that program.
Absolutely.
And the thing is, that I think really the best thing about that program is that the kids have this sense of everybody here is just like me, you know, and that helps them with their self-esteem, and they connect and they talk to each other. Sometimes we can take them to basketball games. So I think it's a really wonderful program. So that falls under our first mission of helping to improve the lives of individuals living with sickle cell disease. Now, the second issue is, and I have to tell you a little bit about sickle cell disease so that I can share the second mission with you, and that is it's an inherited disease. You get it from your parents, and if both parents have sickle cell trait, which means they have one sickle gene, then that means there's a 1 out of 4 chance that every child will have sickle cell disease. So both your parents have sickle cell trait. You got a sickle gene from your mother and a sickle gene from your father, as you know, Jabril, and that's how you got sickle cell anemia. Now, the thing is that sickle cell trait is a carrier state. It is not a disease. It doesn't make you sick, and sometimes people don't know they have it. And every baby born in every state in the country is tested for sickle cell disease at birth. And in the Detroit metropolitan area, I'm the person that picks up the phone and calls the family to tell them that the child has sickle cell disease. And frequently, the parents didn't even know that there was a chance that they could have a child with sickle cell disease. And then they are devastated because they're caught off guard. So the second mission of the Sickle Cell Association is to help people who are at risk for having a child with sickle cell disease know what all their choices are, you know, so that they can make an informed decision so that they won't have a baby with sickle cell disease by accident, only by choice, knowing the challenges that they might face, you know. So the way we want to wipe sickle cell disease off the face of the earth is with a cure. So we don't want to tell people that both have sickle cell trait, oh, you shouldn't have a baby, you know, or if you get pregnant and you should have prenatal diagnosis, and if the baby has sickle cell disease, you should terminate the pregnancy. It's not that. It's that we want you to be aware so you won't be caught off guard. So that's our second mission. And then the third mission is what you're really helping me with today, and that is to provide awareness. So to let people know, because one of the things that I always say is that people don't know much about sickle cell disease, and what they do know is frequently wrong. Okay. Like they think that our patients are drug addicts, that we don't live to be, that our patients don't live past 21, which is an absolute myth. The vast majority of our patients live well into adulthood. And another myth is that, isn't that just a black thing? Don't only black people have sickle cell disease? And in fact, in the United States, you see it most often in African Americans, but you also see it in every ethnicity, because having sickle cell trait protects you from malaria. And so that's how the gene was allowed to grow. Then I also have to say, I have to kind of brag about the fact that we serve as the coordinating center for the Michigan Department of Health and Human Services newborn screening program for hemoglobinopathies. So hemoglobinopathies are all blood diseases, okay? So every blood disease that's tested for at birth, we serve as the coordinating center for that. And we've gotten a lot of support from the Michigan Department of Health and Human Services, and they in fact have a strategic plan to address sickle cell disease across the lifespan. So that's really in line with our mission and the challenges that we're facing now in terms of helping adults to have a better quality of life.
Wow. You actually just gave us a lot of information there. And that is wonderful that the Sickle Cell Organization is doing all that, from the blood screenings to Project Enrich and everything you mentioned there. And that brings me to my next question, because you said there that a lot of people have wrong information, have false information. Like they're like, well, you shouldn't have a baby just because you have sickle cell. So can you tell us exactly, since you're the doctor, you're the professional on this, what sickle cell is, what sickle cell disease is?
All right. So, Jabril, sickle cell is a blood disease. It's a disease of the red blood cells. Now, everybody knows leukemia is a form of cancer, and it's a disease of the white blood cells. Sickle cell disease is not a form of cancer. It's a chronic, lifelong illness, and the problem is with that red stuff that's inside the red blood cell. It's called hemoglobin, okay? And instead of making normal hemoglobin, people with sickle cell disease make sickle hemoglobin, and the sickle hemoglobin has a tendency to line up and form these long strips, and that causes the cells to take on a sickle shape, and it also causes them to be sticky and fragile, okay? So these crescent shape or sickle shape, you know, a sickle is a tool that farmers use to cut weeds, and so, you know, that's one of the things I say about sickle cell disease. A lot of people don't even know what a sickle is, you know, so it's named after something that a lot of people don't even know what it is. But anyway, these crescent shaped cells can stick to each other, they can stick to the wall of the blood vessel, and they can cause this blockage. And because red blood cells carry oxygen to all the different parts of your body, if you have blocked blood vessels, then that part of your body doesn't get enough oxygen. So when that happens, it causes severe pain, unbelievable pain. I mean, when women talk about the pain of childbirth versus their sickle cell pain, they say there's no comparison, you know? Yes. And so I'm just trying to give you an idea. And plus, the pain just comes out of nowhere, and it can interrupt your life, you know, and sometimes it's brought on by stress. So you have a big exam to take, and you're trying to study, and you're staying up late, and then you have a sickle cell pain episode. So it can be very disruptive. And I'm looking at you and thinking that might have happened to you before, even by the look on your face.
Happened.
Yeah.
Okay. Had exams, finals coming up, and then I'm up 2, 3 o'clock in the morning.
Right.
The next day, I'm just out of commission. I can't even. And I'll be honest, I ended up failing a few classes, failing a few classes because I did not get to finish, and then they weren't. And of course, the professors weren't going to hear my excuses. Well, I did not know that I was going to have that.
Yeah.
So I absolutely understand 100% as someone with sickle cell. And my mother has said that. She has said what you just said about the women with
childbirth.
That she's like, sometimes when she's in pain, she just wishes, man, I'd rather be having a baby right now.
Right.
So we understand the pain.
Yes.
We understand that World Sickle Cell Day is approaching.
Right.
So can you tell us a bit about that?
Yeah, World Sickle Cell Day is Monday, June the 19th, okay?
Okay.
And on June the 19th, there was a landmark article published in the New England Journal of Medicine that proved that giving penicillin twice a day would dramatically decrease deaths in infants with sickle cell disease. And so June 19th is a really important day for sickle cell, and also June 19th happens to be my birthday.
All right.
So I feel like, man, I was born on World Sickle Cell Day, so I
Exactly.
know that I was here to help really try to make a difference
You were
in
born to
sickle
do
cell.
this.
There you go. And plus being Charles Whitman's daughter, all of that, right?
Right.
Okay, so what we're doing is we're relaunching our High Five for Sickle Cell campaign. Okay, and what that is you do a high five with your friend, you post it on social media, and then you either text the word 5 to 52,000. That would add $5 to your phone bill. So it's kind of like painless giving, right? Because you have to pay your phone bill anyway, you know, and then extra $5, okay. And that comes to the SCDAA. And the focus of that money is really going to be improve the care of adults living with sickle cell disease. And then the other thing is that you can visit our website and you can make a contribution of any multiple of $5. $5.55, $55, $5,000, whatever you can give. So we're really asking, and you know, it's kind of that Bernie Sanders concept. You can get a small amount of money from a lot of people.
Right.
So let's say you high five with your brother and you put it on social media and you donate $5, but then 5 of your friends do it and 5 of their friends do it and 5 of their friends do it, then that's how we can really make a difference in the lives of individuals living with sickle cell disease. And support for all the hard, I really think we're doing good work and we're working hard to improve the lives of individuals living with sickle cell disease. The other huge event that's coming up for us is our walk.
Okay.
So this will be our 4th annual walk, and it's at the Museum for African American History. It's on September the 9th. Okay, you can register at 9 o'clock and the walk starts at 10. If you pre-register, it's only $25, and you can do that at our website. And instead of saying the website, I'm just going to say Google Sickle Cell Michigan and the website will come up, you know, and that way you don't have to remember anything. And you can make a contribution. You can sponsor a walker. Some of our families have, you know, 3 or 4 children, and it's expensive for them to walk, so you can actually help, you know, to walk. And the whole idea with our walk is that we wear red. And I told you sickle cell disease is a disease of blocked blood vessels. So wearing red and flowing around the city of Detroit the way the blood needs to flow in individuals living with sickle cell disease, because that would end the pain and the suffering.
Absolutely.
So we had 800 walkers at our last walk, and it rained, you know. So we're hoping to have 2,000 walkers. We just want everybody to come out. You know, breast cancer gets a lot of support. Everybody knows about pink. And AIDS gets a lot of support, and we just want to bring sickle cell disease to the forefront the way a lot of these other illnesses get a lot of attention.
Absolutely, absolutely. And as you can see, I'm wearing my red today.
All
That was
righty.
intentional.
Okay,
That was intentional.
all right. I didn't get the memo. You should have let me know.
No, I just knew that I would do it because of, again, me living with the disease.
Right.
And then, so at the walk, you said that you are all wearing well?
Yes, we're going to all wear our sickle cell T-shirts.
Okay, and then we have the web. Just Google for the website, Sickle Cell Disease Association, and then the any other upcoming events besides the walk, or how do we get information on that?
Okay, so if you go to our website, and I'll tell you what it is, www.scdaami.org.
Okay.
But again, if you just Google Sickle Cell Michigan, that'll come up, and you can push on the button. You can enter the website. I think we have a really beautiful website. You can, there's a donate button. Of course, you know, with any nonprofit, the first thing that comes up is the donate button, but you can get lots of information about sickle cell disease. And we have sponsorships down to $100, you know, so small businesses that might be interested in supporting us, the sponsorship package is right there on the website. All you have to do is click on it and you can fill it out and send it to us. So we're really encouraging people to come out for World Sickle and to come out for the walk on September the 9th at the museum. That's a Saturday at the Museum for African American History, an appropriate place to have a disease that predominantly affects African Americans in the city of Detroit. And registration is at 9. The walk starts at 10, but we really encourage you to pre-register, and that'll get you in a little bit faster.
Yes, okay, absolutely. Thank you, Dr. Shurney, for coming on with us and telling us all that information about the Sickle Cell Disease Association World Sickle Cell Day. And as you can see, I brought up the website here. So it is
great.
scdaami.org, and that's the Sickle Cell Disease Association. Like she said before, the website is very beautiful, and they have their social medias there, Facebook, Twitter, Instagram, Google. So go follow the Sickle Cell Disease Association, and again.
And I challenge everyone that's on the phone right now to open up your cell phone, type in 52,000, 52000, and then put in the word 5. And it'll ask you, would you like to donate $5 to the SCDA Michigan chapter? Then you have to put in your zip code. And then when your phone bill comes, there'll be an extra $5, but you will have done something to help improve the lives of individuals living with sickle cell disease. And if you share that with your friends, if you post it on Facebook, if you encourage other people, together we can make a difference in breaking this sickle cycle.
Break the sickle cycle, absolutely. Thank you again. I will be there. I know I will be there at the World Sickle Cell Day Monday.
June 19th. June.
Right.
See, you're losing track of time there.
June 19th.
We are out of May, and tomorrow is Christmas, right? So get your tree.
Monday, June 19th, World Sickle Cell Day.
Okay, and I'd love to come back anytime you'll have me.
Absolutely.
Thank you so much.
Thank you.
Okay.
There comes a time when we heed a certain call, when the world must come together as one. There are people dying. Oh, when it's time to lend a hand to life, the greatest gift of all. We can't go on pretending day by day that someone somewhere will soon make a change. We all a part of God's great big family, and the truth, you know, love is all we need. We are the world, we are the children, we are the ones who make a brighter day, so let's start giving.
There's a choice we're making, we're saving our own lives. It's true, we make a better day, just you and me. Well, send them your heart, so they know that someone cares, and their lives will be stronger and free.
As God has shown us by turning stone to bread, and so we all must lend a helping hand. We are the world, we are the children,
We are the ones to make a brighter day, so let's start giving.
oh, there's a choice we're making, we're saving our lives. Get through, we make a better day, just you and me.
When you're down and
say, come follow me now, right now.
It's live.
Live.
In the D with Mr.
BB.
BB.
It's Live in the D with Mr.BB every Thursday at 9 a.m. right here on WVI 107.3 Radio We Can See.